Mr. Jeffery Patterson, Chief Executive Officer from the Cuyahoga Metropolitan Housing Authority. I am very excited to hear how things are from your view on the ground. Mr. Patterson, take it away.
Again, for those of you who don't know, my name is Jeffery Patterson. I'm the Chief Executive Officer of the Cuyahoga Metropolitan Housing Authority, and I'm very excited to be a part of this initiative. I'll start off by just giving a few fast facts about CMHA. First, the Cuyahoga Metropolitan Housing Authority is the first housing authority chartered in the nation, chartered back in 1933. It's one of the 10 largest housing authorities in the nation. We have over 60 developments with 10,500 housing units, and then we provide another 15,600 housing units. Combined, we serve over 55,000 people across Cuyahoga County. The average income for a public housing resident is $8,400. The average income for an HPP resident is $10,800. Next slide, please. The mission of the Cuyahoga Metropolitan Housing Authority is to create safe, quality, affordable housing opportunities and improve the quality of life for the communities that we serve. We strive as part of our vision to I was at the vision to be a leader in cultivating safe, stable, and dynamic communities of choice where people can strive for success. I now want to kind of focus a little bit more specifically on, what brought us to the table as part of the Achieve Greater initiative. For so long, health and structural inequities in the Black communities have been ignored. Achieve Greater, I think, is a major step towards addressing these persistent issues within the Black community. CMHA, Case Western, and UH, I think, are committed to providing communities with a better future, strengthening those, providing things for a better future. All people should have the opportunity to receive necessary medical resources to have a healthier life. Sanjay reached out to me, probably maybe 2 years ago now, and asked me about the possibility of partnering with this. And we've already been doing some work in our Cedar High Rise with another physician with UH, dealing with trying to get people to work on cardiovascular systems, as well as trying to record some of that data. This was pre-COVID. And I thought that it would be a good partnership, but we had some conditions. And one of those conditions was, and just to be clear, what this project brings these services into the community, which is where they need to be. You need to be able to get out, talk to people, and to be able to establish those partnerships. I think one of the things that we learned from our COVID experience is that, there's just not that trust. And that trust can only be built by consistent engagement and participation. And I think the Achieve Group allows us that opportunity to be able to work towards the goal, to be able to gather the data and be able to try to track and find ways to improve, but also have a sustained and develop relationships to give people the confidence to seek the assistance that they need to be able to address some of the concerns that they've had in the past as it relates to medical conditions. So often, people are discouraged by it, don't believe in it, don't trust the system. And it's just very important that we have that opportunity to give people avenues where they can learn to trust and can learn to commit, and that those services are out and available. So I think that, this process, this opportunity will provide that. And we're looking forward to being an active partner in this. As you can see, we have sites all across the county, and we want to look to find ways to try to get folks engaged and have community partners at those various sites in order to be able to ensure that this is progress. For me, I'm not interested in doing something as a one-off, something that is quick, and next year we don't know that it exists. One of the things that's attractive about this is that it does offer some opportunities for sustainability. And that, I think, is key for us to be able to make this effort a success. So Dr. Sanjay and my friend from Detroit, I think, did a very, very good job of going through and explaining it all from a technical level. But I think that, you know, from a more practical level, it's going to take rolling up our sleeves, engaging multiple people, and having a sustained effort in order for this to be able to go forward. And I'll be the first to say that there are always issues of trust. And I think that hopefully we can begin to work to build on addressing those things. What I don't want to do is to not give the effort because we don't think it's going to work. What I do want to do is find trusted sources within the community to be a part of this process with the effort of trying to establish relationships that will last for a period of time. We're not going to, you know, be able to address every inequity that's gone on in society forever. But what we can do is begin to start that process to make those changes, to make sure that the children and the folks that we're dealing with 15, 20 years from now have a longer life expectancy than some of us that were probably reflected in that chart that in the charts that both of the doctors showed earlier. So for me, that's where it starts. For me, it's getting those resources out there. For me, it's building up that trust with the community and utilizing the community to be a part of this process. So as I said, we're excited about it. We're looking forward to it. And my last point will be, you know, the conference that I'm at right now in Washington is a conference through the Council of Large Public Housing Authorities that I'm the chairman of. And what we're having a conference on it's called the Housing Is Initiative, and it deals specifically with cross-sector partnerships. Partnerships that involve folks that are not necessarily doing housing, but finding ways to bring other things into housing, to support housing and to make it better. And this partnership with UH and CASE is an example of one of those cross-sector partnerships that is much needed, need to be more. You can't just look at the housing and say that that's somebody else's problem. You need to be able to come out and be a part of it, invest in it, and try to be able to make work. We saw from COVID what happens if something happens to people and folks aren't prepared. We have to do a lot better. We owe it to ourselves. We owe it to the people that we serve. And again, I look forward to being a part of this. So thank you, and I'll turn it back over to the moderator.